Hello guys, in this video we will start with the cardiopulmonary resuscitation, and in this video we will cover about the BLS, that is basic life support. In the part 2 of this topic we will cover in another video in which we will constitute the ACLS portion. In this video we mainly focus on cardiac arrest, cardiopulmonary resuscitation and BLS, that is basic life support. So, starting with the cardiopulmonary resuscitation, that is CPR. This is an emergency procedure which is series of action performed until further measures are taken to restore return of circulation and breathing in a patient of having cardiac arrest. So, this is a procedure via which we will try to return the spontaneous blood circulation and breathing of a patient in cardiac arrest. So, CPR is a life saving procedure. It is very useful where someone's breathing and heartbeat has stopped, means we cannot palpate the pulse and patient is not breathing. In this patient we will have to start the CPR, and it is very useful procedure. Nowadays it is expected that everyone should learn CPR. This may save someone's life during an emergency. In today's world it is very common that cardiac arrests are happening very commonly, as you can know. Our president, Dr. APJ Abdul Kalam, also died because of cardiac arrest, and there was no one there to give a CPR to him. Therefore, to learn CPR is very important for each and every person, not only medical students or doctors or nurses. It is important for each and every individual. Now, what is BLS? BLS means basic life support. BLS refers to sequence of procedure performed to restore the circulation of oxygenated blood after a sudden pulmonary and cardiac arrest by chest compression and pulmonary ventilation performed by anyone who knows how to do it anywhere immediately without any equipments. Generally, basic life support is done outside the hospital. It is done generally outside the hospital immediately when there is no equipments available, and it can be performed by anyone, any person, medical staff, anyone who knows how to give a CPR can do a basic life support. Now we will know few important terms. First is the automated external defibrillator, that is AED machine. AED machine is an automated external defibrillator. This is a machine with sophisticated computer system that analyzes a patient's heart rhythm using an algorithm to distinguish the shockable rhythm from the non-shockable rhythm. What are the shockable and non-shockable rhythm we will see in this video as we go on, and provides a visual and auditory instruction to the rescuer to deliver an electrical shock if the shock is indicated. AED machine is a machine we will see in this video only. AED machine is a machine which will detect whether the rhythm, that is the rhythm of heart, is shockable or not. If it is shockable, then it will sound like shock should be given, and if it is non-shockable, then we have to continue with the CPR. Now, what are the components of basic life support, that is BLS? First thing of basic life support is the scene safety. Remember, when the patient is unconscious, first you have to see whether the individual is in a safe environment or not. Suppose everywhere there is a fire or the patient is unconscious in the middle of the road. You cannot perform CPR immediately in the middle of the road. You have to take the patient into a safe place where there is no other danger. Then you have to start the CPR. So first is the scene safety, very very important. If you are asked in MCQ what is the first step of basic life support, and if there is an option which is showing the scene safety, then that is the answer. And the second is the check for responsiveness. How will you check for responsiveness? In an adult, first you will shout, and if you know the adult's name, then call the adult's name loudly, if he doesn't respond, then you have to start for the emergency response system. Means you have to call other people around you and ask for help. That is activation of emergency response system. And if multiple persons are present, then ask one person to call the ambulance or go and fetch the AED machine. Then, after checking for the responsiveness by tapping the shoulder and shouting out loud, that is known as checking of responsiveness. If the patient is not responding, then you have to check for breathing and feel for the pulse. You have to do these two things simultaneously. One hand should be over the carotid. Carotid pulse is easy to palpate. So, carotid pulse, you have to try to feel the carotid pulse, and via your eyes you have to see whether the chest of the patient is rising up and down or not. If the chest movement is not present, means patient is not breathing. And if you cannot palpate the carotid pulse within 10 seconds, within 10 seconds you have to palpate the carotid pulse. If you cannot find, or it is hard to palpate the carotid pulse, then you have to assume that the pulse is absent. And when the pulse is also absent and breathing is not present, then you have to start CPR immediately, right? So these are the components of basic life support. I will repeat this for you. Number 1 is the scene safety. Number 2 is the check for responsiveness. Number 3 is the activation of emergency response system. Call the ambulance, ask for the AED machine, and ask a rescuer to help you. Then check for the breathing and check for the pulse. If the breathing and pulse are absent, start the CPR immediately. This is the component of BLS, that is basic life support. Now, in cases of BLS, it is generally C, A, B. C for compression, A for airway, and B for breathing. You have to remember this. We have the BLS guideline, that is basic life support, that we generally do outside the hospital, and we have the ACLS, that is advanced cardiac life support. This is done generally inside the hospital. In cases of BLS, we do CAB, that is compression, airway, breathing, as you can see in this diagram. But in cases of ACLS, that we do inside the hospital, that is ABCD, that is airway, breathing, circulation, and then disability. So this is the difference between the ACLS and BLS. In ACLS, we do ABCD, that is airway, breathing, circulation, and D for disabilities. So this is the difference between the ACLS and BLS. Now, what are the steps of CPR? We will see one by one the steps of the CPR. First, check for the carotid pulse on the side of the neck. Keep in mind not to waste time trying to feel the pulse. Feel for no more than 10 seconds. For 10 seconds, you can feel, not more than that. If you are not sure, then you have to assume that the patient's pulse is absent. If the pulse is absent, then always start the CPR. And CPR should be in ratio of 30 chest compression and 2 breaths. Like you have to count 1, 2, 3, 4 while giving the chest compressions up to 30. After giving 30 chest compressions, you have to give 2 breaths to the patient in the mouth. We will see how to give the breath in the following as the video goes on. So in 30 chest compression and 2 breaths should be given. Use the heel of the hand. You have to use the heel of the hand. We have the hand here. We have the hand here. These are the finger, and this is the heel of the hand. Via the heel of the hand, you have to give the chest compression. Where will you give? We will give in the lower half of the sternum, in the middle of the chest. Put your other hand on the top of the first. As you can see in this picture, you have to put via this heel of this hand you will give the compression, and we will put the other hand and interlock the fingers and give the compression. In the first picture, this is how the carotid pulse is checked. This is how the CPR is started. Now, straighten your arm and press straight down. There should be no bend in elbow. No bend should be present in elbow. Your elbow should be straight, arms should be straight in one line, and press down straight. And compression should be, in adults, compression should be 2 to 2.4, that is 5 to 6 centimeter into the person's chest. and at a rate of 100 to 120 compressions per minute. Compression should be 100 to 120 compression per minute. So what is it? We have, remember this very important point. The rate of compression is asked in MCQ, and also what is the chest coil should be. This means when you are giving the compression, the chest should go inside 5 to 6 centimeter depth, or 2 to 2.4 inches. Now be sure that between each compression you completely stop pressing the chest and allow the chest wall to return to its natural position. Leaning or resting on the chest between compression keep the heart from refilling in between each compression and make CPR less effective. What do you mean by this line? Via this line, it means when you are compressing, it should go down up to 5 to 6 centimeter and it should come up to its normal position. If you do not give time to recoil the chest, then there will be inadequate blood feeling inside the heart and there will be a bloodless heart and there is no use of CPR. So allow the chest to return to its natural position. Then only there will be refilling of heart. This is a very important point. So up to this, what we have seen, first is the scene safety, then check for the responsiveness of the patient by tapping on his shoulder and shouting out loud. After that, check for the pulse and breathing for 10 seconds. Within 10 seconds, you have to check for the pulse and breathing. Then, if the pulse and breathing is not present in a patient of cardiac arrest, you will have to start the CPR in a ratio of 30:2, like 30 chest compression and 2 breaths should be given. And the chest compression, while giving the chest compression, the chest should compress from 5 to 6 centimeter and the rate of compression should be 100 to 120 compressions per minute. Now, what is the hand placement position? In cases of adults, children of 1 to 8 years and in infants, there is different techniques. First, normally in adult, I have already told you how to give it. We will give the compression with the heel of one hand and interlock with the other hand. This is normally that we do in adults. In children, the body is small, 2 hands are big enough. So in children, via only one hand we compress down the chest. And in infants, the one hand is very big for an infant who is less than 1 year of age. In infants, either we use 2 fingers or we use 2 thumb technique. I will show you the 2 thumb technique in the diagram below. And while compressing, in adults, we compress by 5 to 6 centimeter, that is 2 inches approximately. In children also, we can compress up to 2 inches. But in cases of infants, you press down 1.5 inches only, not much. And compression rate should be 100 to 120 compression per minute. It means 30 compression should be given within 15 seconds. Then only we can complete 120 compressions in 1 minute. Here we can see a diagram how to give the chest compression. Here the first diagram is wrong because the elbow is bent. The elbow should not be bent. The elbow should be straight, as you can see in the second and the third diagram. So this is how a chest compression should be given. After 30 chest compression, stop. You have to stop and open the airway. Now we will learn how to give a breath, how to open the airway. The opening of the airway is done by the chin lift, head tilt or jaw thrust. Put your hand on the person's forehead. In this picture, here you can see the person have put his hand on his forehead. Via putting his hand over the forehead, the head is tilted backward. The head is tilted backward. And the lift of the person's jaw by placing your index finger, middle finger on the lower jaw and lift up. Do not perform the head tilt chin lift maneuver if you suspect a neck injury. If a cervical spine injury is present or neck injury is present, there is no need of doing all this. So chin lift, this is a chin lift procedure. How to do a chin lift? You place 2 fingers and you lift up the chin upward. This is the chin lift. And you place a finger over the forehead. You place the hand over the forehead and you tilt back the head. This is head tilt. And the third is the jaw thrust, in which via the thumb you retract the upper lip, and via the other four fingers you lift up the jaw. This is known as jaw thrust. So the jaw thrust maneuver is grasp the angle of the lower jaw. Angle, you know, the you have the mandible. This is known as angle of the lower jaw via the angle of the mandible and angle of the lower jaw, and lift it up with both the hand, one on each side, moving the jaw forward. If their lips are closed, then open the lower lip using the thumb. So this is how we do the jaw thrust. Give a breath while watching the chest rise. While giving the breath to the patient, in today's world, after COVID, in 2020 we had the COVID. After COVID, the mouth to mouth ventilation, the mouth to mouth breath is not done. Either you do mouth to mask breathing or mask to mask breathing in cases of BLS, when you do not have other equipments. Generally, a pocket mask is should be used by a medical personnel, and they should have it all the time. So give a breath while watching the chest rise. While you are giving the breath to this patient, after proper mouth opening, the chest should rise up. If there is no chest rising, then the procedure that you are giving is not good enough. So repeat with giving a second breath. Breath should be delivered over 1 second. One breath should be delivered over 1 second. Within 1 second, you have to complete one breath. Resume chest compression immediately and switch quickly between the compression and rescue breath to minimize the interruption. I have already told you, you have to give 30 chest compression, 1 2 3 4, you have to count like this. Then you have to give two breath. Each breath should be completed within 1 second. Then you have to start 30 chest compression. Again you have to give two breath. Again you have to start 30 chest compression. Again you have to give two breath. And this should be continued until and unless ambulance arrives or AED machines arrives or you are going to the hospital. This cycle should continue. Outside the hospital, you cannot declare a patient of cardiac arrest that he is alive or he is died. Therefore, this is the procedure that we have read. This is about a one rescuer procedure, like if you are alone present and you are alone helping the patient. Now we will see two rescuer. When there are two person present to help. First is you and another person. The second rescuer is prepared to use the AED. First rescuer, like you, will assist the patient, and another one of your friend, if present, you will ask your second rescuer to go and fetch for the AED machine, which is very important. And you begin the chest compression and conduct the compression out loud. Conduct means you have to count it very loudly, 1 2 3, whenever you are giving the chest compression. The second rescuer applies the AED machine. He will come back with the AED machine. Generally in US and UK, AED machine is available in a street very easily, but in India it is not available. But via calling the ambulance, they will bring the AED machine to you, as well as they will carry the patient. So second rescuer applies the AED pads. The second rescuer opens the patient airway and gives the rescue breath. If two persons are present at that time, then you will continue with the chest compression and second rescuer will give the rescue breaths. Switch the roles every 5 cycle. What do you mean by one cycle? One cycle, this 30 chest compression, these 30 chest compression and two breath, this is one cycle. Then this is the second cycle. Now this is the third cycle. Like this, there will be 5 cycles. After giving the 5 cycles of chest compression and breath alternatively, after giving 5 cycles, we have to switch the role. Like the person who was giving the compression will be switched by the second rescuer. Now second rescuer will give the compression and the first rescuer will give the breaths. So this is how you should alternate in between them. Now number 6th point is, be sure that between each compression you completely stop pressing the wall. As you have already told you, after complete 5 to 6 centimeter compression, you have to give time to the chest to recoil in between each compression. The rescuer who becomes tired may tend to lean on the chest more during compression, switching the role. as CPR is a difficult procedure, the person gets tired. Therefore, you have to switch the role in between the rescuers. It is better to switch the role even every after every 5 cycles. When the AED is connected, now suppose AED machine have arrived and AED is connected, minimize the interruption of CPR by switching the rescuers while the AED analyzes the heart rhythm. When you are attaching the AED, after attaching the AED, give some time to the AED machine, approximately 10 to 20 seconds, to detect the cardiac rhythm. And at that time, no other person should go for the CPR at that time when AED machine is analyzing the rhythm. Now we will see a very important topic, that is adult mouth to mask ventilation. I have already told you that mouth to mouth ventilation is not done today's date. We generally keep a pocket mask always. Whenever a person needs it, we can put a pocket mask. Here in this diagram, this is how a pocket mask look like. Now, give 30 high quality of chest compression. Seal the mask against the patient's face by placing the four fingers. You have to place four fingers of one hand across the top of the mask. Here you can see of the top of the mask, there are four fingers of the patient present, and thumb on the other hand along the bottom edge of the mask, and thumb should be present over the bottom edge of the mask. Here you can see the thumb of the other hand. This is how the mask is sealed. Using the finger of your hand on the mouth and the mask, open the airway. Head tilt and chin lift should be done, avoided in neck injury, and press firmly around the edges of the mask and ventilate by delivering a breath over 1 second as you watch the patient's chest rise. Now you have to give the breath via this. You have to give the breath, and while giving the breath, you have to see whether the patient's chest is rising or not. When the patient's chest is rising, means you are giving a effective breath, and breath should be within 1 second each breath. Now, BLS for children. ACLS and BLS for children is bit difficult. I have already told you about the chest compression. In children, we use the one hand technique, and compression should be 2 inches, that is 5 centimeter, and rate of compression should be 100 to 120 compression per minute. And we can, in children, remember I have told you that in adults we use 30 is to 2 ratio, like 30 chest compression and 2 rescue breath. But in cases of children, we will use 15 is to 2 ratio, that is 15 chest compression and 2 rescue breath should be there. After 15 compression, stop the compression. We will do the head tilt and chin lift maneuver, and we will give the breath to the patient. And use of pediatric pads for the children. While in the AED, there are pediatric pads present for children 1 to 8 years of age. We have the infants. Infants are less than 1 year of age. In cases of infant, generally we give the tactile stimulation to see the responsiveness. We generally check the brachial pulse, and if the pulse is absent, we start the CPR either via the 2 finger or 3 finger technique of one hand, and the compression should be 1.5 inches, not more than that in cases of infant, and compression should be 100 to 120 compression per minute. Here in the diagram we can see this is the CPR placement of the child, CPR hand placement. This is how the CPR is given via the one hand technique in the child, and this is the how the CPR is given to the infants. This is the 2 finger technique, and this is the thumb technique. This is the thumb technique of while how to give CPR in infants. Now here you can see the diagram. This is an AED machine. AED machine should be used if the individual does not respond on shouting or shaking, an individual is not breathing, and carotid pulse is not palpable. We will use the AED machine, and there are different types of AED machine. Here you can see two diagrams. Now basic AED. First, when you get an AED machine, first that you have to do is power on. You will have to start the AED machine. Then choose the adult. What kind of patient do you have? You have an adult patient or you have a pediatric patient. There are two types of pads available. They have adult pads also, and they have the pediatric pads also. Now attach that to the bare area of the chest, not over any kind of cloth. You have to, or any kind of medication patch. You have to remove everything, and you have to attach the AED pad over the bare area of the chest, and make sure the cables are connected. You have to connect each and every cable. Now place one pad on upper right side and other pad of the chest few inches below the left side. Now, clear the area to allow the AED rhythm. After attaching the pads, you have to wait for approximately 15 seconds for the AED machine to detect whether the rhythm is shockable or not. If no shock is advised, suppose the AED machine have told that rhythm is not shockable, shock should not be given, then restart the CPR immediately. If the AED machine indicates that shock is needed, then clear the individual. When the AED machine suggests shock, no individual should touch the patient. Otherwise, you will also get shocked. Therefore, no individual should touch the patient while AED machine is giving the shock, and making sure no one is touching them and that the oxygen has been removed. While giving the shock, oxygen should be removed. Ensure visibly that the individual is clear, and you have to shout out the word clear. Then you have to give the shock. You have to, while giving the shock, nobody should touch and oxygen should be disconnected. This is how the AED pad is placed, very important. This is the right side and this is the left side. Over the right side, the AED pad is placed just below the right clavicle, and over the left side, we place it where the apex of heart is present, just below the nipple. In females also the same way. In cases of children, either we will put that according to adult, or we will place the two pad in between the chest, one on the upper side, another one in the back of the chest, other side over the back of the chest. Similarly, in infant, in the front of the chest, in the back of the chest, and in cases of pregnancy also similarly as you do in a normal adult individual. Now press the shock button if it suggests the rhythm is shockable. Immediately resume the CPR starting with the chest compression, and after 2 minutes of the CPR, analyze for the rhythm with the AED. Continue the following AED prompt as the AED suggests. So remember, it is very important. After the AED gives a shock, you should not go and check for the pulse. After giving a shock, you have to immediately start the CPR again. After giving CPR for 2 minutes, 2 minutes means there will be almost 5 cycles of CPR. After giving CPR for 2 minutes, then you have to check for the pulse of the patient, and AED machine will tell you whether you have to further give the CPR or shock or not. Now, there are 4 types of ECG rhythms. There are 4 types of rhythm present in the cardiac arrest patient. First is the shockable rhythm. There are 2 types of shockable rhythm and 2 types of non-shockable rhythm. Shockable rhythm means you have to give the shock in these patients. So shockable rhythm is the ventricular tachycardia and the ventricular fibrillation. These are the shockable rhythm, very important, asked in MCQ many times, and you have to know this also as a doctor also. So first is the shockable rhythm. Shockable rhythm is the ventricular tachycardia. Here you can see this is the ventricular tachycardia, how this is looks, and this is the ventricular fibrillation. Very close, this is the ventricular fibrillation. In these 2 cases, you have to give the shock to the patient. And non-shockable rhythm are the asystole and pulseless electrical activity. Asystole means there is no such electrical pulse present like this. This is an asystole. And pulseless electrical activity means you cannot palpate the pulse. In the carotid, we do not get the pulse, but there is an electrical activity present in the ECG. This is known as pulseless electrical activity. In cases of asystole and in cases of pulseless electrical activity, you should not give shock, and in cases of ventricular tachycardia and ventricular fibrillation, you have to give the shock to the patient. Like after giving the shock and continuing the CPR, if suppose the patient's pulse is normal and patient starts to breathe, then you have to keep the patient in recovery position. This is how a recovery position is: hand under chin to keep the mouth open, and arm bent to prevent the rollover, and leg bent to support the position. This is how a recovery position is. Recovery position refers to one of series of variation of lateral recumbent and 3/4 prone position of the body. If a person is unconscious but the breathing is present and no life threatening condition is present, it should be placed in a recovery position. Putting someone in recovery position will keep their airway clear and open, and it will also ensure that any vomit or fluid won't cause any kind of choke. Means if the person is in supine position and if a person vomits, then the vomitus will go inside the trachea or esophagus and the patient might aspirate. But if we keep the patient in recovery position, even if the patient vomits, the vomiters will come out. There are less chances of aspiration and less chances of vomiters to go into the trachea if we keep the patient in recovery position. This is the recovery position. Next, we have the ACLS guideline. We will see the ACLS guideline in our second video. Here we will see another very important thing, that is a few points about the choking. What is choking? So choking is when there is an object which is obstructing the airway, which is obstructing the trachea. This that is known as choking. Here the individual is holding his neck via the two hands. This is the hallmark of choking. This is the classical sign of choking. If a person comes to you with both his hand around his neck, means the patient is getting choked. Therefore, you will have to perform the Hemlich maneuver. Hemlich maneuver is a first aid technique to dislodge an object blocking someone's airway and used for choking. How to do Hemlich maneuver? You have to give 5 back blows and you have to give 5 abdominal thrust. First, you have to give the back blow and you have to give the abdominal thrust in cases of choking. Here you can see. This is also here you can see this is how a choking patient presents to you, and you have to make a fist. Make a fist with one hand and you have to hold that fist with the other hand, and you have to give the pressure to the abdomen so that the object gets dislodged from the trachea. But in cases of infants and children, it is very difficult to do the Heimlich maneuver like this. So in cases of infant, you will place the infant over your one hand and you will tap over the back of the chest, and again you will place the infant supine position. Then you will give chest compression to the infant so that the object comes out via the mouth. And in cases of pregnant women, generally back blows are given in similar manner, but in pregnant women the fist is present over the chest. Over the chest you have to give the Hemlich maneuver, not over the abdomen in cases of pregnant women, but in cases of normal individual you will give the pressure to the abdomen. This is all about the choking that you have to know. So thank you for watching, guys. In our next video we will cover the further about the cardiac arrest and the ACLS guideline and advanced cardiac support, ACS also. So thank you for watching, guys. Please do like and subscribe and share this channel with your friends. Thank you for watching, guys.